Fox Sports Trending now.
5-day games in Major League Baseball, including San Diego at Colorado coming up. For the Rockies, outfielder Matt Holliday is starting. He hit nearly .350 at AAA, 14 RBIs in his 15 games there. Great pitchers duel in D.C. Max Scherzer, 7 innings, 10 strikeouts. Currently, it is Phillies leading 2-0 over the Nationals in the bottom of the 7th. Aaron Nola, 6 scoreless innings, 7 strikeouts for the Phils. Red Sox are up 6-0 over Cleveland in the top of the 6th. Boston just scored their 6 runs in the bottom of the 5th inning. David Price on the mound. He's allowed only 1 hit. The Giants and Madison Bumgarner lead 2-0 at the Mets in the top of the 7th. Tigers up 5-0 over the White Sox in the bottom of the 6th inning. One NFL preseason game tonight. It's on Fox TV. Philadelphia at Cleveland. Tiger Woods 5 back at golf in New Jersey. I'm Steve DeSager.
We are
Hello, Cynthia Tieche here with Dr. Tieche on Coffee Talk with Dr. Tieche.
Welcome.
How you doing today?
Good. You?
Pretty good, pretty good.
You had your hair did?
Nothing new. I wanted to go black, but
That's quite a statement.
not black, but pretty dark. You know,
You'll
what
never
you
go
said.
back.
That's right.
Wow. Okay.
But I know
Good
you
that
didn't
I
want me
know
to go
that.
any darker, so.
Good thing I know that about you.
I think
Okay.
some really dark hair would look good.
You've had black hair before.
But not black, dark. Just
You said go
darker.
black.
But not really black, like darker.
It made you look like Elmira.
Elvira?
Elvira.
Seriously?
Elmira. Yeah. You know, the one that did the
I
horror
know.
shows. Yeah.
But it's not Elmira, it's Elvira.
Well, it was one of them. Anyway, it made you look like her. Whoa.
Whoa. Or I could just go bleach blonde.
No. Why don't you just leave it the way it is?
Anyways, enough about my hair. Before we get started on God only knows what topics you're going to bring up today, I want to remind everyone about our open house this Saturday from 10 to 2. We're going to have lots of specials. And, I can't forget that Monday is Dr. Tieche's birthday, so maybe I'll remember to bring cake for the open house.
Unlikely.
Wouldn't that be funny if I made everyone sing to you?
Yes, I would like that.
I know you would like that, wouldn't you?
No, not at all.
He would. I should hire someone to come do like a singogram. What are those called?
Probably that, a sinogram. Yeah, I
sinogram?
don't know. No, I wouldn't like it. I don't like that. You know I don't like any attention
He
at all.
loves it. He loves it. If you bring him a cake, he will be very happy. Or I will be happy because I'll eat it for him. Anyways, come to our open house from 10 to 2. We open at 8:30, but specials and all kinds of fun stuff. I'm going to do some giveaways that day too. We're probably going to give away like lip injections, probably going to give away some shots, some IVs. You can only win if you come and get a raffle ticket. So make sure you stop by. Well, I want to talk a little bit about weight loss and vitamins helping with that. So there are vitamins that will help with weight loss. I mean, if you're sluggish and things aren't working right, vitamins can get them going again, especially if you're deficient in those vitamins. So that's how and why we have vitamin shots. Those vitamin shots will be half off Saturday only. But typically when we do a ton of these shots and people swear by them for energy and for weight loss. But what is it about our shots? And we're not going to give you the secret recipe exactly because we know there's some people that would love for us to tell them what we're putting in there so that they can try and duplicate it. Figure that out on your own. But what vitamins is like really helping people have more energy and lose weight with these shots? What is it?
Well, we know B vitamins are definitely a big one for energy, and that's, both the B complex and B12 help definitely with energy. They do help assist with what we call lipolysis, which is the breakdown of fat. Now, in our stuff, we use other things in addition to that for sure. We use what's called the MIC combo, and that's really some more B vitamins. That's methionine, inositol, and choline. And so that adds to that. As well, and do you want me to tell them more what's in there?
No,
That's it. Well, we do have some other vitamins in there, and they are used, and they do help accelerate weight loss. They do accelerate energy.
Majorly.
And so, they do work.
We do so many of these shots. I don't even know the most updated number. A lot. a lot. And it's not like one and done. People come in, you typically get them weekly, and people keep coming back because they feel so good on these shots. So we have a famous one, the Super Fat Burner, but we have other variations of shots, and then we have IVs. So what's the difference between one of our shots and IVs?
Well, the IVs have a lot more of the vitamins in them, for sure, than a shot. So a vitamin shot has really about 3 mLs of vitamins, where a vitamin IV has about 12 to 15 mLs of pure vitamin. So it's quite a bit more. Since it's so much more, it really can't be given in a shot because it's a pretty big amount. And so it's given through an intravenous, which is, hooked up to your arm and infused in over typically about 15-20 minutes, and that way your body can get all of that. It's a pretty good wallop because it's, like I said, maybe if you see that, it's about 4 or 5 times the amount. Plus there's some additional ones that are in there that we couldn't give in that shot because it's just a space thing. But those really do help. I mean, one of the main things that's in there that really helps is magnesium, and magnesium helps with a lot of stuff. It helps with aches and pains. It helps with fatigue. It does help relax people, and it's one of our most common deficiencies is magnesium. So it really does add to that, and kind of gives people a good sense of well-being. And so vitamin infusions have been around for a long, long time. They've been around since the 70s. And when they started, it was Dr. Myers who started that, and not like the Myers rum, but Myers, different one, because he called it a Myers cocktail, and everyone thinks it's with that. But it's not. And he was kind of considered an outcast by traditional medical, practitioners, just as anyone who practices outside the norm is considered that way. Really, functional medicine doctors are considered that way.
We're the rebels.
We're the rebels. And really, what's been found is all of his stuff has been proven to be true. And, lo and behold, these things are given, hundreds of thousands of them a day probably are given of these vitamin infusions because people do feel better. They do work. They are actually used in traditional medicine. High-dose vitamin C is used in cancer treatment. It is also used for Crohn's disease, ulcerative colitis. It helps heal liver problems. So he was kind of a forerunner with this. And then it started with the vitamin shots because people couldn't get all these infusions, so it was to kind of boost those up individually.
And there is a difference in vitamins. So there's B12, but there's all types of forms of B12. And so it's important that you're getting the proper forms, the most natural forms that you can absorb and really feel.
And that's a good point because I see some people who come in who we check everyone's B12 level and the vitamin D, and I'll see them that they'll both be on supplementation and they'll both be really low. And when I look at what they're taking, most of the time they're taking cyanocobalamin because that's the most commonly made one. It's the least expensive of them. And since people don't really know that there's a huge difference in absorption, that's the one they prescribe. So if someone's taking that by mouth, they probably are not going to get good absorption. But more importantly, there's a lot of people that are giving themselves B12 shots at home, and they're using cyanocobalamin. Now, so there is 3 types. There's methylcobalamin, hydroxycobalamin, and cyanocobalamin. And in that order is the order of their absorption. So methylcobalamin has the highest absorption, and it has the highest usable rate because it's got a methyl component on it. And that's really what your body wants. It wants that methyl component because it does a couple things. You have the B12, but then it becomes a methyl donor to your liver to help detoxify stuff. And so when people are getting methylcobalamin, their levels are very high. When they're getting cyanocobalamin, some people are able to get decent levels with it, but many people will almost be like they have had none. And if you switch them to methylcobalamin, it's pretty much a dramatic shift for them because all of a sudden now they're actually feeling the effects of that.
And I've had some people say, well, I've gotten B12 shots and they didn't do anything for me. And come to find out, that's what they were getting. They were getting the cyanocobalamin, not the methylcobalamin, and there you go. That's why. So if you've had them previously somewhere else or had them prescribed and you had them at home, you probably were getting cyanocobalamin. It is cheaper, and that is usually what your pharmacy or your insurance is going to end up giving you.
Mm-hmm. And the same is true with vitamin D. A lot of people, in fact, most people that we see need to be on a vitamin D supplement because we know vitamin D is very powerful in fighting disease. And, the studies show that higher levels of vitamin D help cut down certain chances of cancer as well as chronic disease by 50%. So we want to boost that. And even though vitamin D is typically produced in our skin from sun exposure, one would think that everyone in Florida would have really high vitamin D levels. And actually, the opposite is true. Almost everyone I see uniformly is low, like in the 10 to 20 range. We want them to be at 60. And so most people, I'm just going to throw out these numbers, even though they don't mean anything. I mean, just to put it in a frame of reference, most people need between 2,000 and 4,000 international units or IUs of vitamin D a day. And so sun exposure does give you about 2,000 units per 2 hours of sun exposure, continuous sun exposure.
Wow.
So that would mean you'd have to have 2 hours of continuous sun exposure a day. And even though most people say, oh, I get a lot of sun, I'm out in the sun all weekend, or whatever, going running forth to their car, they're not really out in the sun for 2 hours.
Or what I've heard is, but I drink a lot of milk. Isn't milk going to give me D?
Right, and that's another thing I was going to come to. So vitamin D, milk, breads, all these things that say vitamin D fortified, most of them only have about 100 units of vitamin D. So considering that you need 2,000 to 4,000 units, you'd have to drink quite a bit of milk. So since vitamin D is so powerful, we do produce a fair amount of it, but we utilize a lot of it because it's a very powerful antioxidant. So it's fighting off a lot of stuff because we know that we have lots of exposures to all kinds of crap out there. And so really the best and easiest way to do it is taking a proper vitamin D supplement, with D3, with also D and with also K, vitamin K and A in it as well to help with the absorption.
So not just your vitamin D that you see on the shelf at Publix.
Yeah.
It needs to be a little bit more than that if you want to really actually
because
absorb
that's the
it and
thing
get
too.
the benefit.
People can be just taking a vitamin D supplement and again seeing really no benefits from that.
Yep.
And so that's frustrating.
Yeah. So you need a little mixture. You need to make sure you're getting the proper vitamin D and B. And vitamin D and B will help with weight loss and energy and depression and skin, not just immune, but immune also. They're so important. Like people really, really do need to be making
Well, vitamin
sure
D
that
has definitely been linked to depression and mood swings and things like that, particularly when people's levels are low. And we've seen some people whose levels are very, very low. And, it's kind of weird how low they are, but like in the below 10 range.
Wow.
Yeah.
So it's important, and kids should be getting this. So obviously, like he said, a glass of milk is not going to do it. You most likely need to be on some type of supplementation, a good multivitamin, and not a junky multivitamin, an actual good multivitamin. You should be doing that, and your kids should be doing that. So I wanted to talk about those because they have a lot to do with weight loss. They will help you with your weight loss. They will help you with your energy. If you research and find out, you can probably get this supplementation orally, but you don't always absorb it all. So that's why we carry oral supplements for D and B and all of that. But we recommend shots and IVs also. When you get a shot or an IV, 100% of that is being forced into your cells and absorption. And isn't that, how?
Well, yeah. When you take something orally, first that tablet has to be absorbed. And that's one of the main problems with most supplements is variable absorption. Depending on the quality of the vitamin, depending on what it's put together with, what we call the binding agents that are in there. And then if someone actually has stomach and colon issues, most people have, leaky gut, imbalance of their gut flora, their bacteria flora. And so what happens is you don't get good consistent absorption of these vitamins. So yes, you could be taking the prescribed amount, but yet still not really seeing the full effect of them. So when someone's dieting, in addition, now they're not eating a full amount of food, even though we know that our diets are lacking really all of the proper nutrition, even at best. So then you take that diet and you restrict it down a little bit. Now we know that we're not getting everything. So really for completeness and to keep people feeling their best and optimally burning fat, which is what their goal is while they're restricted, that's why these things really come in handy, and they really do add to that and really kind of boost people along a bit.
Okay. We're going to go to a break and then come back and talk about some more fun stuff.
You have a lot of choices on your radio dial, but there's nothing like talking to the goat.
Hey, this is Cynthia from Recharge Clinic. Guys, are you ready to feel like you're in your prime again? Dr. Tieche is Ocala's leading medical doctor treating you for hormone replacement, weight loss, vitamin infusions, and more. You can feel confident that you are being treated by an experienced, knowledgeable, caring physician. Come see us, 47 Southwest 17th Street, Ocala, or give us a call, 352-512-9996.
It's going to happen to all of us. It is the one insurance we can guarantee there will be a claim on. So the question becomes, will your family have enough money to pay for their mortgage, for their food, or their education? Or will they have to borrow money and struggle? Lauren Gibson State Farm has a solution for every situation and can help get you protected today. Take care of your loved ones and take the worry off your mind. Please visit our website, insuredbylauren.com, or call us at 352-355-3340.
Not only does Triple Crown manufacture trailers, but they also service and repair all makes right at their facility. From boat trailers to enclosed trailers and everything in between. So challenge Triple Crown with your bearing job, rewiring, welding repairs, gate addition, hitch installation, or accessory. They're happy to help you service all trailers at Triple Crown Trailers. Call them today at 352-368-7885. That's 352-368-7885. And speak to their knowledgeable service staff to schedule your next appointment. Or stop by and visit Triple Crown's 2,100 square foot parts showroom at 4251 South Pine Avenue in Ocala. You can count on Triple Crown Trailers for quality service when you need it.
Isn't it time to get to the beach? Whether it's a vacation, family getaway, or business meeting, the Holiday Isle Oceanfront Resort on St. Augustine Beach is your ideal destination. Relax on our beautiful beaches or poolside and grab a drink at the Tiki Bar and dine in at the Beach Garden Restaurant and Lounge. We're minutes away from historic downtown St. Augustine. Make plans with your family and friends or schedule your next business meeting at the Holiday Isle Oceanfront Resort at 1-800-626-SAND or online at holidayisleoceanfront.com.
BJ Trophies, so much more than just trophies. Now offering in-house production of decals, signs, and banners. Let them put your logo or design on almost anything. BJ Trophies also has traditional wedding, baby, and anniversary gifts, plus custom 3D crystal pieces, jewelry, and engraving. BJ Trophies making one-of-a-kind awards for your one-of-a-kind events for over 30 years. Don't forget, BJ Trophies now offers banners and decals for your business. Stop by BJ Trophies on Northeast Jacksonville Road or call them at 732-2249. That's 732-2249 or online at bjtrophies.com.
You cannot ignore Facebook. Facebook live streaming.
The GOAT FM.
Hello, Cynthia Tieche here with Dr. Tieche. We were discussing vitamins and vitamin shots and IVs and how good they are for you and for weight loss and energy and all that fun stuff. So last week, we ran out of time and we were just getting to the juicy part of something. And so I didn't even mean it that way, but whatever. But you'll know what I'm talking about. Anyways, we were just getting to the good part and we had to go. So we said, we'll continue it. And we've had a couple people ask us, hey, can you continue that? So we are going to continue that topic. Well, we were talking about, you tell them, you're the doctor.
We were talking about vaginal health. We were talking about vaginas, pretty much. And one of the things that we were talking about was vaginal strengthening exercises and vaginal tone and things like that. You know, some of the things that happen as we get older, we lose our hormone levels, drop down, so some of the tone within our vagina, we lose some of the skin tissue. Within our vaginas, yeah. Well, the vaginas that I own. And then, so some of that gets lost. And then, you know, with childbirth or damage to stuff after you may have had a hysterectomy or something, you lose some of the muscular tone. So we were starting to talk about how to help that. So one of the things, is the well-known Kegel exercise that is used, and that's kind of a pelvic squeezing type exercise to help with those muscles. But there's a lot of variations on that. And so when I was reading about it, I found some interesting variations on Kegel. So there is a couple of devices that people can use. So Kegel you just do while you're sitting there or standing, and it's basically what that is for people who don't know. It's sort of people who are doing it all the time. Really, it's like starting and stopping your urine stream, as that's the muscle that you're contracting. So you can do that all day, practice it, and it helps strengthen those muscles. Men can do it as well. But then there are two devices that are out on the market that you can do that kind of assist with that. So one actually is produced here in Ocala. It's called the Kegelmeister or Master, one of those two. Maybe it's the Master, I don't know. Anyway, it looks like a speculum, like a vaginal speculum that's inserted, and it actually has some springs on it that you can adjust the tone with, and you squeeze down on it, and that kind of increases, kind of like lifting weights for your vagina. So that's one. And there is another one that is similar to that you insert, and it has a little air pump there that kind of spreads the speculums apart so that there's continuous contact or good contact all the way around the outside of the vagina, and it has little, I would say electrodes on it, but it's not really that, but it's a way of delivering a low dose electrical stimulation in there that causes the muscles to contract. And with time, you turn it up and turn it up. And what it does is it exercises all the pelvic muscles internally and helps strengthen all of that. And it really works well for urinary incontinence and people who have had reconstruction or surgery down there and are really trying to redevelop everything. So it's something that works really well. Now, on another note, there's even stuff that's stranger than that. There are jade balls that are inserted that women have to put in there and actually hold, and that by them holding it helps strengthen those muscles. But the one thing that I did find that I thought was unusual are vaginal cones. And vaginal cones are like tampons, basically. They are like a glorified tampon. It's inserted, but they have a little kind of hook on the end of it, and you progressively add more weight to it. So you basically put it in there and squeeze down on it, and then slowly add weight to it. And so they're basically hanging, the weights are hanging between your legs, but you are holding them together with your pelvic muscles. So I thought that was kind of an interesting thing.
That is interesting.
It did seem a little unusual, but it is on Amazon, so you can find it by squeezing your pelvic.
But how long are you holding it there?
That part I didn't read, but you can do weights up from 20 to 100 grams. And so it's not a huge amount of weight, but...
Well, I mean, you probably would get just as good of a result if you were using the Kegelmeister.
Yeah.
So, might be easier.
Well, there's a lot of people that do a lot of interesting things, and then really when I clicked on that, then it took me to another site that had a lot of different...
That could be scary.
Yes, it did, because there was a lot of piercings down there, and some people with their piercings hang a lot of things off of their piercings. And so that looked a little, both men and women, and it was pretty unusual to see all sorts of weights hanging off of what seems to be very tender and delicate genital parts with weights,
But they're doing it for pleasure, not for tightening or anything.
No, that's why I'm saying it took you to another site. It was not, that was not.
Got on a whole new level.
It got a whole new level,
Okay. So interesting stuff. So you would want to tighten that area up for what reasons? Incontinence, but what other reasons would you want to
some people just have, some people have what's called a rectocele, and that's where your rectum, because those muscles are not strong, kind of, prolapse forward, so you can have difficulty moving your bowels. And, also there are some women who have had hysterectomies or difficult childbirths who have had a lot of damage to some of the pelvic muscles, and so they have a lot of pain and discomfort during intercourse or just daily. They just have a lot of pain. So this helps kind of renew and kind of re-strengthen these muscles, because there's not really a lot of exercises that you can do otherwise. So it does that. And in fact, there really are, interestingly, I was at a course, and there's actually pelvic physical therapists. and they actually specialize that. Now, there are none in Ocala, but they actually specialize in women who have had really difficult problems down there, have had bad deliveries and all kinds of stuff that have caused a lot of damage, or hysterectomies, and need work with actually relaxing some of the muscles, because some people get trigger point pain down in that area. Some of those muscles spasm, and so these guys and gals, whoever they are, they help work with that. So it's really a kind of a niche, a really unique niche of physical therapy.
It's a real problem, though. I mean, if you have a problem down there,
huge problem.
You definitely want to have some solutions and get some help. So if you've never had a problem down there, it's interesting. I mean, you're just unaware of it. And then when you do have a problem, then you don't even know what to do.
Correct.
So there is help for those problems. If you're listening and you have anything like that, you can get help. What else you got? Did you have some trivia today?
I do have a lot of trivia. I was going to talk about some ways of lowering your cholesterol with some vitamins, but I might as well throw a couple of these little trivial things in here because people seem to like them. So, and
he refused to tell me.
I refused to tell you. So,
I was getting annoyed last night. He would not tell me any of this.
Do you know what a merkin is?
I'm a merkin.
You're a merkin?
Merkin.
I doubt you're this kind of merkin.
I'm a merkin.
So,
am I supposed to know this? Am I going to look stupid for not knowing? You like to make me look dumb, don't you?
Yeah, but I'd be impressed if you knew this.
Oh, impressed.
Maybe you can start wearing one. I don't know. A merkin.
Oh, wearing a merkin.
A merkin. A merkin is...
Wait. Does anyone else know what a merkin is? If you know, type it in there.
Yeah.
I doubt it.
Yeah. A merkin is a pubic wig. And basically, it is like a wig for your genital area that was actually worn by prostitutes back in like the 16 and 1700s, because they would, prior to this modern age of everyone grooming themselves, they would groom themselves because of lice that they had in their pubic area. And so I guess to still bring on suitors, they would wear this merkin, and that's where it came from.
So I'm American. I'm not a merkin.
You are not a merkin. Yes.
So that's interesting.
Pretty weird.
So that's an old thing, like long time ago.
Yeah.
Like how long ago?
Like started in the 1600s, but you can actually buy merkins now because they are considered a toy.
Really?
Yeah.
I might have to look that up.
Okay.
That's interesting. A merkin. If you knew what a merkin was, you need to comment on there.
Yeah.
Because I mean, maybe someone knew what it was and just never heard the name.
So some of these pages, when you look up some of these weird trivia facts, give you lots of other weird trivia. And one of the things that it did, for merkin, it went to this other thing that said basically that, it made a little comment that said prostitution is legal in most countries, except in Iran. It's not legal in Iran. But what is legal in Iran is you can get married only for several hours at a time.
Really?
Yeah, and so that's their way around it. So basically what they do in Iran is you get what's called a temporary wife.
No way.
Maybe that should be in the U.S., a temporary wife. But anyway, you can get a temporary wife there. And so it's kind of rent a wife, Try a wife out. So I thought that was kind of funny.
Try a wife out.
Try her out. I'm returning this one. I want a refund on this one. Jeez, not what I want. Anyway, yeah. So there's a couple of little trivias.
Find that out.
So, do you know how many calories are in a teaspoon of semen? Since we always are talking about diets, we want to make sure whether that's on our meal plan.
Wow.
I just thought everyone should know.
But I will guess 10.
Pretty close. 7.
Look at me.
Yeah, that's pretty interesting that you know that. Did a little previous research on that?
No, but it's a small amount.
Yeah.
So it can't be that much.
What's a teaspoon, though? A teaspoon of butter has a lot more than that.
So wait, just while you were blubbering over there about semen, I looked up merkin on Amazon.
They have them?
Yeah, and it says human hair.
Okay. Yeah.
That actually looks like human pubic hair. Is that?
That's nice.
That's something.
Yeah.
Okay.
So another little trivia thing is guys who help with housework have 50% more sex than guys who don't.
There you go. Ladies, do you hear that? Men.
No, men need to hear that.
Do you hear that?
Men need to hear that. That was an interesting little trivia. So I'm always cleaning and doing the laundry, and I've not found that to be true personally. But anyway,
you don't clean.
I do the dishes every damn day.
Okay.
So here's another interesting fact, and this is just typical of how men think, and this is what I thought was really funny. So, only 6% of men need an extra large condom. But, by and large, the majority of condoms sold are extra large.
Why?
Because everyone wants to have that package that it says, I need extra large.
Well, are they falling off?
I don't know if they're falling off or not, or maybe like the extra large is really the equivalent of a small, and then there's extra large, and gigantic, and
maybe the condom company is saying extra
for
large
ego. But I thought that was funny
to sell more.
Right.
The fact that I need extra large,
exactly.
so I'm gonna buy.
Isn't that funny that they have that? Yeah,
that is funny.
Yeah, and then there was another trivia thing that I mentioned.
Oh gosh.
This one's a little funny. I thought it was kind of weird that when they hang men, they get an erection when they die. And I didn't realize that. So, yes.
That's interesting.
It's called like the death erection or assassin erection or something like that. Isn't that weird?
That is weird.
I know, it's like, I guess it's the last thing to go, going out and something.
Going out with a bang.
Literally.
Interesting.
So let's get on to something more informational.
Well, all of that was pretty informational.
It is. But, so I see people all the time that have really slightly to moderately elevated cholesterol, LDL, HDL, and triglycerides. And so, those are our blood lipids, and those kind of everyone sort of has an idea that we want to keep them in good ranges because of preventing heart disease. And we all know that, if someone has a high cholesterol, someone gets put on a statin, which is a medication that lowers that. And most people don't want to take statins. They have a fear of taking statins because, there are some side effects with them. A lot of them cause muscle pain, bone pain, and really we don't know all of the other things that they cause. So there's a big movement in medicine, a lot of people just want to go ahead and treat people's cholesterol, get it down below that magic number, and they're doing their job. They're checking off all the boxes, and that person's in the right spot with their cholesterol by putting them on a statin. But then there's a whole other group of people that don't want to take these medications. So if you do have kind of borderline numbers, and what are borderline numbers? So just to put it in perspective, we look at a couple things. We look at total cholesterol, we look at HDL, which is high density lipoprotein, low density lipoprotein. And those are the things that we kind of look at. And then we look at triglycerides. So total cholesterol is one thing that we look at, and we want that number below 200. So really just around that number is okay. But we'd like it a little bit lower, but that number is okay. Anything above really 240 to 260 is considered high and probably needs some form of treatment or something to be done. Now, that doesn't necessarily mean medication, but it needs something to be done. The other thing is that we look at our LDLs, low density lipoprotein. Those are the bad cholesterol. Those are the ones that we want to be low. And those we want below 80. That's our target number with that. The other thing that we look at are HDLs, and that's the good cholesterol. And those are the ones that actually help prevent plaque. So LDLs form plaque, which is like the little deposits in your arteries. The HDL does not. It helps prevent that. So HDL we want above 40. So we want these with certain numbers because that's doing more prevention. And then we throw in the mix triglycerides. And triglycerides are really kind of floating little fat islands in your blood. And that's really based on, some of it's based on how much fat you eat at any given time, but some of it is just people have a hereditary tendency for that. So triglycerides, we want that number below 150. So that's just kind of putting that in perspective of what those things are and where they kind of need to be. So natural ways of lowering cholesterol, and if you are like in this borderline range and you really don't want to take statins. So one thing that's a simple thing to do, and it works, is increasing your fiber. And so that means taking things like psyllium husk, which is what is in Metamucil, but it's also in high fiber cereal, it's in oatmeal, but then there's also a thing called citrus pectin. And citrus pectin is really the fruity I mean the rindy part
Like the
of
pulp?
the pulp of the citrus plant. And so those things, what they do is they bind your bile and cholesterol as it is passing through your gut and carry it on out. So what it's doing is by removing it, it's just eliminating it that way, and it's a very natural way of doing it.
So you can get these in capsules, both
You
of
can
these,
get
right?
all of those in capsules.
So
Yes.
psyllium husk and
Citrus pectin.
citrus pectin.
Mhm. The other thing is eating more fruits and vegetables, and they kind of work the same way, because what we're trying to do is increase our fiber, and so and that also helps lower that. An interesting thing that I came across was cooking with more herbs and spices as opposed to cooking with plain stuff. And there's certain ones that are, we should use more garlic, because that's just a natural cholesterol lowering agent. Ginger and turmeric. Those things naturally have been used, in many other countries. It was kind of backwards how they found. I don't really think that people knew that they were using it to lower that. It just turned out that these people had lower cholesterols and triglycerides, and when they looked at what they ate, they found that they had diets that had higher amounts of that. So that's kind of another little thing. Eating unsaturated fats as opposed to eating saturated fats. So unsaturated fats are things that we really should all be eating anyway. Things like olives, olive oil, avocados, more fish, and certain nuts. Nuts in limited amounts, because nuts are a thing that you can definitely get carried away with, because they're just so readily available, and the jars are easy to eat them. If we had to shell them more like pistachios, we'd probably eat more reasonable amounts. But you get a big thing of peanuts, and they have some coating on them, and you eat a whole bottle. That's probably not what we're talking about with that. We're talking about more just measured portions. The other big thing, and this is something I'm going to talk to more about, is avoiding trans fat. Now, this is the biggest thing that we really have to avoid, trans fat. Do you know what trans fat is?
Yeah. Well, I know that they're trying to get it out of foods, and I don't really understand. I just know it's bad, and it's in certain foods that it shouldn't be in.
Right. So trans fats are, what they did was they took regular oils and they treated them, and they basically added these hydrogen atoms to them. And what they did is it acts as a preservative, really, to that. So what it does is it adds to the shelf life of that oil. So it makes it, last longer, and it also makes it much cheaper. Really, that's the main
like all the cheap canola oil and vegetable oil. I know that that's all junk. Is that what that is?
Yes, but that's not really all the trans fats. So trans fats are, they're unsaturated fats, and they actually very much increase your LDL. And so I'm going to come back to where we go. I'm going to finish the list of how we avoid that, but we want to avoid trans fats. We're going to come back to trans fats, because that's probably the biggest thing that we have to worry about. And these other ones actually are bigger contributors to lowering cholesterol than actually eating fat. One, eating less sugar and eating less carbohydrates. That is a big thing.
How?
Well, because interestingly, carbohydrates and sugars actually increase your cholesterol and LDL more than eating fat. And so that's been proven really with the keto diet. So even lowering triglycerides. So the keto diet, which is a fat-based diet, it's primarily about 40 to 50% fat, then 20 to 30% protein, and then the rest carbohydrates. That would seem contrary to eat if someone has high triglycerides, or secondly, high cholesterol.
They're concerned about that usually. If kids want on keto, they're like, yeah, but I have high cholesterol.
But the opposite is true, because that diet severely restricts their carbohydrates, and it really restricts their refined sugar. And what you find on that is people who are on that keto diet for more than several months, really about anywhere from 3 to 6 months, their triglycerides drop dramatically, their LDL drops, and their HDL goes up. Just the things that we want to happen.
Wow.
So the keto diet is kind of similar, really, as far as and so really what I was saying back to eating less sugar is really kind of going to a more Mediterranean style diet. And really what does that involve? It really is a basic food groups thing. It's a protein source, a fat, which usually involves olives and these other kinds of things, and vegetable, which is going to be a low glycemic vegetable. It's going to be, a salad. It is going to be broccoli, cauliflower, or those things. It's not going to be, a high glycemic carb. And so it's, we're going to stay away from biscuits. We're going to stay away from, that kind of stuff. And that helps lower that. The other thing is soybeans, which I thought was kind of unusual that helps as actual as a natural cholesterol deterrent, but it was mentioned in there. Green tea, niacin, we know does that, and it's really more nicotinic acid more than just plain niacin that really does lower triglycerides. And carnitine, which is, a thing that we have in our vitamins quite a bit, and people take that as supplements a lot, and that really does help lower cholesterol and stuff more naturally. So when we come back, I'm going to go on to trans fats because I have a whole lot I want to talk about with that.
Yeah, I'm interested to hear. We'll be back.
Gainesville, Ocala, all time. The GOAT FM.
Hi, this is Lauren Gibson from Lauren Gibson State Farm. A lot of people remember to insure their auto and their home, but not their life. If you have someone that relies on your income, you need life insurance. It's as simple as that. Life insurance really should be called love insurance because it's for those that we love. At Lauren Gibson State Farm, our mission is to protect and provide for you and your loved ones. Please visit my website, insuredbylauren.com, or call us at 352-355-3340.
Hey, this is Cynthia from Recharge Clinic. You need to come by and get one of our amazing vitamin IVs. Dr. Tieche has made a great cocktail that's going to help you have more energy, lose weight, a better libido, and even sleep better. Come see us at Recharge Clinic, 47 Southwest 17th Street in Ocala, Florida. RechargeOcalaClinic.com. That's RechargeOcalaClinic.com.
Document Technologies has been helping Ocala business owners save money on their copiers and printers for more than 7 years. Now they've added the full line of award-winning color copiers and printers from CopyStar. CopyStar has a reputation for their overall low cost of ownership and unmatched reliability. Combine that with Document Technologies' fast local service and 5-year guarantee, you have a combination that can't be beat. Plus, they have special programs for nonprofit organizations and government programs. To find out more about how Document Technologies and CopyStar's award-winning color products can help your business, call Bill Schroeder at 352-368-6664 and start saving today. We use Document Technologies, and so should you. Call 352-368-6664.
And in Gainesville at 372-6666.
Document Technologies, the only copier company you'll ever need.
Are you looking for more than just a handyman? With Father and Son's Home Improvement, no job is too big or too small. Whether you need that honey-do list completed, a remodel, lawn maintenance, or just general repairs, Father and Son's Home Improvement does it all. Give them a call for your free estimate today. Visit their Facebook page to see all their latest projects. You won't be disappointed. Father and Son's Home Improvement. No job too big or too small. They do it all.
This is Trey Adams, the owner of Touchdown Lawn Care.
Touchdown!
Touchdown Lawn Care offers a wide variety of lawn care services that would transform your lawn into a beautiful landscape. If your yard is in need of some professional attention, or you simply do not have the time to maintain it, then call Touchdown Lawn Care to receive the treatment your lawn deserves. Look us up on Facebook or call 352-598-3720. Touchdown!
This is Justin and Matt. Join us at 8 a.m. on Monday mornings for Unwanted Opinions, sponsored by the Touchdown Group.
Touchdown!
Servicing all your pool, lawn, and cleaning needs. Score big this season with the Touchdown Group.
Nailed it. The GOAT FM. We're Gainesville, Ocala's all talk.
Cindy, Cynthia Tieche here with Dr. Tieche. We were just discussing some interesting topics. If you have high cholesterol or borderline and you're trying to find a more natural way to lower it, these are some really great ideas. And if you missed it, when we're done, just rewind it and go back. Some really easy natural things in food and spices and different kinds of supplements that you can take. And it's going to talk more on trans fats, right?
So trans fats are really bad, and they're being banned by a lot of different things, but they're still out there. They're very common in cookies, crackers, pizza dough, which I thought was weird, but it's the oil. It's the oil that's used in pizza dough.
Because it makes it last longer and it's cheaper.
Cheaper, yeah.
Of course.
Pastries, things like that. So there's a lot of trans fat in that, and we know that trans fats increase LDL and decrease HDL. Remember, we want the opposite. We want LDL low, HDL high. And so a lot of trans fats are in fast food. That goes without saying. That's really because their preparation, the products that they use have a lot of trans fats in them. There is a big trend, though, to give them props. All of them are trying to get out of trans fats, but they're not all there. And the reason is, interesting why we have to target fast foods, not because they're inherently bad, but about 50% of people's food budget nowadays is spent on fast food, and compared to way much lower 20 years ago. So so people are spending half their money on fast food. So it's a real thing. People are out there eating fast food every day by necessity most of the time. I think anyone given a choice would prefer to have a home cooked meal, but we see people every day who they've got their kids are in school, they have these super hectic business lives, and then they run around with their kids afterwards to soccer and baseball and all this kind of stuff, and they just don't have time. There's no time. And not everyone can meal prep, not everyone can afford to have a meal prep service, which actually are not that expensive. I think most people just don't know about that.
There are a lot of
them in Ocala.
Meal prep services that will cook keto, whatever.
And they actually make individual
delicious,
meals.
healthy
really
meals.
Specified on what you want, and they will make meal portions.
Affordable.
Yeah, it's really not that bad. So people really ought to look into that. I don't really have the names of any of them, but anyway, they really do a great job, and they're very nutritious. So anyway, the reason fast foods, have a lot of trans fats, like I said, and they also have a lot of calories. That's the problem. And so they have a lot of carbs and a lot of sugar. And going back to that, we know increasing carbs, increasing sugar increases cholesterol. End of story. And, increasing carbs actually for people, we see all these teenagers who have super bad acne, and we say, that's because you eat a lot of fast food, you eat a lot of grease. Well, it doesn't transfer to that. Interestingly, grease that you eat does not go to your skin and make oily skin. That's a wives' tale. Really what it is, it's because of the carbohydrates. So, and this has been proven out in the keto diet, because people who eat high fats don't have bad acne. So it's just the opposite. And when you remove the carbs from kids' diets, their acne improves. So that's the thing, that's the misnomer. So people have been steering this bad diet idea away. That really started a long time ago with the American Heart Association. Lower fats, eat more carbs, they're better for you. And it was incorrect, and they've readdressed it, but still not 100%. So people still believe that, it's better to eat carbs than fat when it's really not. Now, the carbs that are good to eat are vegetable type carbs. Those are okay because, those are what's called low glycemic, and they're fine. So the other thing that fast foods have is a lot of sodium, very high amount of sodium. Now, most people can tolerate an increased sodium load because they can just basically pee it out. But people who have hypertension, some people have hypertension, their kidneys just retain sodium, and so it makes it more difficult for those people. And so they get their blood pressure exaggerated with this higher amount of sodium. And this was a fact that was in there. I don't know how true it is, but it said that people who eat a diet high in fast food are 51% more likely to have depression than other people. Now, I don't know if that's diet related or that they just become fat and they become disgusted with themselves. That could be it. Or they feel crappy from eating that food, so maybe they do get depressed.
Probably all of the above.
But so anyway, it mentioned that. So the other thing that I see a lot is, along this, like we talk about HDL, LDL, is triglycerides. And so that's the fat, sort of the liquid fat, the fat islands that are floating around in your blood. And there really isn't a good medical way of treating this. There's not, like statins really work for cholesterol and LDL. You can't really treat high triglycerides with this. And this is the one thing that we really want to target. And, there are certain medications, but they're really restricted for really severe cases of high triglycerides. Because we know if someone's triglycerides are super high, they're at very much increased risk of coronary disease. So this is something that we want to get down. So what kind of things lower triglycerides? And you know what? They're the basic things over and over again, these things. I mean, they sound like I'm a broken record, but they end up always being the same thing. Lower your weight. People who are heavier have more triglycerides. Decrease sugar. Decrease fructose, which is that high corn syrup, fructose, whatever is, that's in a lot of foods, and that helps increase your triglycerides. Increasing fiber, again, helps remove some of that stuff. So, you want to increase your omega fatty acids. That's another thing that actually helps metabolize some of that and helps lower your triglyceride level. Exercise is another thing that helps lower it. Lowering your alcohol intake lowers the triglycerides.
How is that?
I don't know. I probably because it's carbohydrate based. So that probably stimulates that whole carbohydrate thing of increasing the triglycerides and cholesterol and all of that. And the other thing is niacin, but there's niacin and people take flush-free niacin, and we think that helps, and it probably does some. It's not as good as what's called nicotinic acid, which you need a prescription for, which is actually a medical grade niacin that really lowers it. But the niacin that people can take over the counter does help, and so we know that every little thing helps, so we might as well take it.
So why is that prescription?
The nicotinic acid? I'm not really sure.
Is it dangerous?
Why. No, it's kind of strong. I think it's expensive, and it's almost medical grade. Yeah. It almost sounds like a tobacco, nicotinic acid, but it's not. So back to this, back to this keto diet thing. We come back to the keto diet again. Remember, it lowers cholesterol, it lowers triglycerides, it increases HDL and lowers LDL. And really, so really the keto diet has got so many variations. But the main variation is, you can vary how much fat you're eating, how much protein you're eating. But the main variable that stays low in all of that is the high glycemic carbs. That's the thing that has to be cut out. The bread, pasta, things like that. Cookies, all the things that we really like, crackers, these things that are easy snack foods, sugary drinks, that's the stuff that we have to restrict. Doesn't mean you don't have any of them, but that can't be the predominant part of your diet. And that's really what has happened, if you look at mostly all the crackers and all of that stuff, they're delicious. There's jillions of them, but we make a meal of them. We make them part of our every meal almost. And so by restricting that portion of it, restricting all of those high glycemic carbs, really it's the easiest way. I mean, if you think about it, someone who's borderline can really make a big dent in these things without having to take medications. And I don't think anyone wants to take statins if they don't have to. But more importantly, they're going to lower all of these numbers and really get some great benefits by becoming healthier. Really, so it's not like I'm eating something that's totally disgusting, like 2 pounds of anchovies a day or something. They're going to be doing stuff that, one, they're going to feel better, they're going to lose weight, they're probably going to get in shape. And so generally they're going to have a better sense of well-being. So
they're going to feel better. And, people want the easy, though. They don't want to have to eat this way and work out. And they don't want that. But there is no easy fix. You only get one body. That's it. This is it. You might want to take care of it. It's like if you had a brand new pair of shoes, but these are the only shoes you're going to have for the rest of your life, you're probably not going to just abuse them like this. This is it. And our body might be resilient and might live for a while even with these bad habits, but you're not going to feel as good, and you're not going to, and it's not even about living long. Yeah, sure, you want to live long, but about enjoying your life and feeling good mentally, physically, the whole thing. This is it. This is the only body you're going to get. So what are you waiting for? Why aren't you taking care of it? If you didn't know, well, the information is out there. Yeah. You can learn.
And it is, it is difficult. It is difficult to make the transition when we have gone from this kind of rushed life and eating that kind of stuff to trying making the commitment. But after you make the commitment, you can do it. That just becomes your life,
easier.
and that becomes your life, and that's what you do. And you know, yes, you're not going to succeed. You know, we don't succeed all the time. We have pizza.
That's
and we
right.
do this, but it's not the mainstay of our diet.
Right.
And
Most
so
of the time,
we try to mostly eat
we're on
really
track.
good, and then you have these indiscretions, and that's okay because that's what life is about. But it can't be that every day you have an indiscretion. Every day can't be a treat. Going to restaurants, 30 years ago was a treat. That's why people only went once a week. Oh, we're going to have a big family outing. We're going to go to such and such, or we'll go to McDonald's, or we'll go here. And that's really what it was meant. And guess what? It worked out fine, and people were better that way. The problem is, it just becomes so prevalent that it's so inexpensive that now it's just become a reflex. It's easier to go to McDonald's or Burger King or Pizza Hut, any of those places, than it is to go to Publix or Walmart or any place and get foods, because just done. You're done, one and done. But it's not long term. It's not good, and it's not going to be the right way of doing it. And so we have to, like you said, we have one body. You got to take care of it. You will feel better. You're right. It's not necessarily about life extension, but it's about quality of life during or when you're here. People who are heavier, they all feel bad. Their backs hurt, their knees hurt, they're
Even
grumping,
being
they're out of
20
breath.
pounds heavier, your feet hurt, your knees hurt, your back hurt, you don't feel as good. Just 20 pounds heavier.
Yes.
So it's important to really take that step into trying to live a better quality life, make a good example for your kids, because they've got to live their life, and so on. So now that we've talked about vaginas, talked about some weird trivia, sex facts, to beat them up a little bit about their diet and being healthier, now I'm going to remind them to come to our open house on Saturday from 10 to 2. Look us up online.
Cynthia's going to be singing on Saturday.
To you for your
Yes,
birthday.
yes.
No, I'm not. I'm not gonna
Acapella.
sing. I'll rap.
Okay. Deal. Everyone heard it. She's going to rap.
I'm not going to rap.
Why?
Because I
So
can't.
you're full of crap. You're not going to rap. That was a
Maybe
rap
you
right
should
there.
rap. All right. Thanks for joining and watching, and hopefully we'll see you at our open house on Saturday.
Hey, this is Cynthia from Recharge Clinic. Come see Dr. Tieche at the clinic to get recharged, offering testosterone therapy for men and women, vitamin infusions, fat-burning shots, weight loss, and more. 47 Southwest 17th Street, Ocala, Florida. 352-512-9996.